Hi, folks. My name is Dr. Richard Castine. We're doing a webinar tonight, our first one, so bear with us here at the Center for Implant Dentistry in Bakersfield, California. This process tonight is really more of a discussion about the edentulous state in America, how to replace teeth, choices you have, what our facility does here, and an introduction to the participants inside the facility and our business. Um, next slide. Next slide. I would say generally, the mouse depicted on the screen is what we typically do all day long. I think the hardest thing for patients to do is just walk in the door. We treat a very wide spectrum of people here in Kern County, many of whom have destroyed their teeth for one reason or another. We welcome them all without judgment. Next slide. This is where I came from. I'm that little tiger sitting on my dad's lap. Next slide. This is our facility on Camino Media. It's about 15 years old. It serves as a wonderful plant for that which we do here. Next slide. I think that what we really do is just see a lot of people. It's kind of a depiction of, I think, the Kern County Fair. This is what 1 million people look like, and you're probably wondering why I'm talking about people. And it's partly because we see such a diversity of individuals. And if you look historically at time and age and teeth, there's some commonalities that are pointed out. And one of them is that it's only recently in the history of the world that people are living as long as they are. For the majority of time, people live to be about 30 years old. Today, the average life expectancy is a little over 82 years. And I think with the developments in pharmacology that it'll be commonplace in 10 or 12 years for the average age to be in the 90s. The reason for all that is really started with here. This is Alexander. He was inventor of penicillin back in the day. And it was really by accident that he developed this. But the influence on pharmacology in our culture, I don't know, it just really can't be emphasized enough, as today hundreds of laboratories around the world are struggling to produce a remedy for the virus. This man developed an antibiotic that saved hundreds of thousands and millions of lives, and he changed the time period in which people could live on Earth with by increasing life expectancy. It's interesting to note that inside the United States, there's about 20% of the population that just does not have teeth. In fact, if you look over time, and you look at different countries, how many teeth you have is somewhat predicated on the country that you live in. And for some reason, the fewer dentists that you have in your population, in your country, probably the more teeth you have. You would think it would be the reverse of that, but it's not the case. In America today, there's probably over 60 million people that do not have teeth. Like I said, I do live in Bakersfield, love it here, and there are a lot of compromised mouths. For example, this one here. A lot of our patients feel embarrassed when they come in, and they're ashamed of their appearance. It affects them psychologically. allows them not to get as good of employment, I think. And it's a major, somehow that little thing between your nose and your chin has a significant effect on both your self image, your ability to chew food, because 60% of digestion happens in the mouth. If you're not chewing it, then you're swallowing it whole. And if you're swallowing it whole, then you end up with systemic issues with your stomach that frequently require surgery. Um, so again, what the heck do we do when people have a whole bunch of bad teeth? And I would say again, the hardest thing to do is just trying to find someone that you're comfortable with that can assist you with good choices and present care. Um, One man that's affected outcome for everyone on earth is this gentleman, Dr. Palomalo. He's a colleague that works out of Lisbon, and he developed this concept of all on four, which we'll talk about in a minute. I love making dentures. It's more of an art form now, but I love it because you can take the most messed up mouth in the world and in a week's time make it look wonderful. Dentures are kind of like wigs, and I personally don't own a wig, but um, yeah, I think wigs can probably make a lot of people look great or a lot of women look great, but you can't go swimming with them. And likewise, um, dentures have their own issues that are inescapable due to the fact that they're, 18th century technology. Today, with the use of implants, you can stabilize the lower denture, which is exceedingly helpful. When you lose teeth, there's a lot of things that happen that we'll discuss. And one of them is your tongue gets bigger. And when your tongue gets huge, it tends to be kind of a muscle that is used to help masticate food. It also helps destabilize lower dentures. But just by putting two implants in a lower jaw and snapping in a lower denture, it can give people uh, greater stability, greater function, greater comfort. Just two implants is a life changer. It's, I think, the standard of care for people that don't have teeth on the lower jaw, at minimum, two implants. There's different kinds of attachment systems that you can use on these implants. Um, of course, four implants is a better idea, just like a four-legged chair is more stable than a two-legged chair. You can put four-wheel drive into your denture and have better bite force and better confidence in speaking. So the gentleman earlier, Dr. Palomalo, he came up with this idea that really one solution is to place four implants in each jaw, with the back two implants being tilted back to have immediate stable teeth. It was a new concept 15 years ago. It's well established and practiced around the world today. Um, it's not the best way to rebuild the human mouth. It's just the best, least expensive way to go about that process. Um, we routinely put people to sleep, take their teeth out, put in implants, deliver immediate stable teeth. They wake up, they come in the next day for a post-operative visit. Uh, for various reasons, most of them aren't in a lot of pain. I think it's largely due to the wonderful IV drugs that we put into the cocktail to create both amnesia and anesthesia for them during the surgery, anti-inflammatory drugs, as well as pain meds. But it's shocking to me how I can take out one tooth on a lower jaw of a 40-year-old person, and they'll be in discomfort for 5 or 10 days. And I can take out all of someone's teeth, and they'll come in the next day and not be complaining about the process. So that's where we are with state of the art today. You can have teeth expressed. You can have secure, natural looking teeth in as little as 1 day. There's many reasons why you want to replace teeth. Um, I would say that if you lose almost any of your teeth in your mouth, and if you live long enough, it creates other changes in the process. Um, Teeth move into the space where the uh, tooth was lost, and over time, you end up losing more teeth. Your ability to chew affects your diet and your nutrition. If it's a front tooth, it affects appearance and whether you want to smile in pictures or what have you. In addition, when teeth are lost, there's a process of losing bone. You lose about 40% of your bone width within 24 months after losing a tooth. If you lose all of your teeth, um, you lose a lot of your jawbone over a period of 20 or 30 years. Figure that your lower jaw is maybe 2.5 or 3 inches thick from bottom to top. And after 20 or 30 years of not having teeth, it is reduced from maybe a 3 finger width to the width of your smallest finger. In addition, the tongue gets larger and is used more as a muscle to break up food. And it's much easier to do what needs to be done to get you back on the road chewing if you got enough bone. If you're just losing a tooth, um, there's several treatment options, but nevertheless, you're going to have a loss of chewing ability and accelerated bone loss where the tooth was lost. Traditional crown and bridge is one way to solve that problem, as is depicted here on the screen. This has been the standard of care to replace missing teeth all throughout the 30s, 40s, 50s, 60s, 1970s, maybe a little bit into the 80s. But today, oral implants are at an advantage over this because you don't have to destroy the adjacent teeth. They last longer, and when you compare the prices, they're not much more expensive than that, predicated you have enough bone to place it. Furthermore, survival rates of a 3-unit fixed bridge is usually about 70% at 10 years, and survival rate of a single implant is typically about 98% at 15 years. So it's just better ideas, better technology, better therapy for a better outcome. The challenge of traditional dentures is one of which chewing foods is predicated on how much discomfort you can stand by placing a lot of pressure on soft tissue that was really never designed to have a denture on it. Additionally, most of my patients are taking some medications. Medications cause a process called xerostomia. This is a fancy word that means essentially dry mouth or lack of saliva. There's multiple things going on with this phenomenon, but not only is the amount of saliva decreased, but the constituencies in saliva is changed, causing teeth to decay more rapidly. But specifically with use of dentures, in order for dentures to work well, you need a wet mouth. And when your mouth is dry, dentures are really a contraindication. There's going to be much sorer tissue and irritation of the soft tissue due to pressure and slipping or movement of the denture, and it's not going to work well. As stated before, the new standard of care in tooth replacement therapy are oral implants. Titanium metal bonds very well with bone. They can look and feel natural. They provide a permanent solution. And the key is they have similar biting force as natural teeth. So treatment options for a missing single tooth is either bridge work or a dental implant As depicted on the screen, there's an implant and abutment. I could talk for 30 minutes just about abutments, but I'm not going to. And a crown that goes on top of the abutment. You know, before you do anything in life that's significant, you just need to have a map. And so many people that have not a couple of dental problems, but a lot of dental problems, what they need is a well thought out plan of care and to really understand the choices that are in front of them. And this is an example of an individual who has 2 implants on the lower right side, who, as of the date of this Panorex, was chewing primarily with their front teeth. And I use it as an example to lead into this next photograph. This is a wonderful patient of mine who I spent 15 years doing this implant therapy. And over time, they lost all their teeth. And we would build like one side at a time. And if you go down this process, it takes more time and it costs more money. It's easier to get everything figured out of where you want to be and work in a comprehensive fashion as opposed to piecemealing things together from area to area. Like I said before, I think the hardest thing to do is find an office that you fit into. We give away CT scans free. We have free consultations here. We try not to have a barrier of dollars between the patient and getting good ideas. I try to give everyone multiple plans of care, hopefully within their budget. If they don't have teeth and they want immediate implant stabilized teeth, we generally put 4 to 6 implants. I always give people just one fee. If I put more implants, I don't charge them additional dollars. After the procedure, people use a medicated mouthwash for the first 2 weeks. They use a water pick to gently clean around and under the teeth. And usually at 6 or 8 weeks, they begin to eat normal food like they did when they were much younger in life. That's about the only care that they have. I would say getting your mouth rebuilt is a process, not an event. It's not as easy as going into In-N-Out Burger. You're going to be seen in this office probably 10, 15 times over a period of 5 months. Most of the therapy is done in the very beginning. After healing is completed, you're essentially going to get built all over again. And there's opportunities for you to have input on how you'd like to design your smile. And we listen to those ideas. In summary, the advantages of immediate teeth is the procedure is very well tolerated. I have videos of 10 or 15 patients giving testimonial to the fact that the discomfort was much less than they anticipated, and they weren't in significant pain after the procedure. I want to be cautious with my words there, and that, of course, every case and every individual has to be weighed on its own merits. Typically, we don't have a need for invasive bone grafts. It's possible to have fixed teeth in a single visit. We can make things hygienic. They can look extremely natural and feel like your own teeth. We typically see these people back in after they're completed 1 time per year to have everything taken out and cleaned and put back in. I'll share with you one or maybe a couple stories of real patients here. The first individual, her name is Carol. I remember the day she first came to meet me. She was unhappy with her appearance and the fact that she couldn't eat food. just not a happy person about her mouth at all, and she needed a mouth makeover, really. And so that's what we provided her. This is what her x-ray and a photograph of her remaining teeth look like. We have a video here that puts together her life story and the effect of rebuilding her mouth on her life. I'll have you watch it with us. The upshot of it is we put 4 implants in her lower jaw to stabilize her lower dentition. And we had a very positive result for her. Her photographs pretty much explain that statement. We'll watch this video now.
I've never had a beautiful smile ever. By the time I was in my 30s, I had to have my whole top rack taken out, and they never took out the rest of the bad teeth. And no one told me that the top porcelain ones would wreck all your teeth eventually. The most important thing to me, to have my teeth back, I mean, besides eating and all the selfish stuff that I want, I do not want to be a humiliation to my grandchildren in kindergarten. And I want to be the person that takes them, and I want to work in their classrooms. I'll get my teeth, and then I'll feel like I'm everything, and I fit in again to them, like I belong, you know?
Carol was a person that had lost all of her lower teeth. She had some upper bridge work that wasn't cosmetic anymore. And I don't think she was functioning at all. I feel lucky to be in her company and to be able to help her with her problems, because I know that I changed her life a lot today. And she's going to chew food really well, and she's going to look much better. And that's going to dramatically change her life.
I haven't smiled this much in 16 years. Yeah, I can't quit smiling. My jaw's hurt. And I love my doctor. And I love all the people that work for him. All the ladies are very nice. I think everybody that it has one missing tooth, or a lot of them, should have it fixed. No one should go without. I think that it was a miracle, and I love him, and I love those girls, and they have made a total change in my life with my family, which is the most important thing to me. I finally feel like my regular self again.
I used to do both the prosthetic and the surgery component of this process. My life got demanding and busy as we were doing more and more cases a month. I phoned an old friend of mine named Dr. Willis, who's a board certified prosthetist, to move to Bakersfield to help me. And I'm lucky to have him here in Bakersfield. He's super good at what he does, very experienced at oral reconstruction. And so I would say that my tasks here at Center for Implant Dentistry are predominantly as implant surgeon and an individual who we co-diagnose cases together. And I do bone grafts, and that's the daily work that I do. And Bob does predominantly the majority of the restorative work. And Bob, if you want to, I'll bow out of this lecture frame myself and allow you to take over the show, starting with the case that's on the machine here. But I invite all of you guys in that are out there, and anyone that you might know that might benefit from a discussion about their oral issues, if they're complex. Look forward to meeting them. My days of work are Sunday through Wednesday. Bob?
Okay, I think we're on now.
Hi, Doctor.
I'm Bob Willis. I work with Dr. Castine. I call him Chip because we've been acquaintances for lots of years. And in the last couple of years, he invited me to come out and practice with him here in Bakersfield. I'm a transplant from St. Louis, Missouri. And I love what I do here at the Center for Implant Dentistry. We could spend hours on almost any of a dozen topics that Chip mentioned earlier. Most of this today seems to be centering on this mouth reconstruction. We call it all on four, meaning that all the teeth in the arch are on only 4 implants, which, as Chip mentioned, is quite a revelation that started about 20 years ago. So, however, this practice is about change. At least the implant dentistry side is, and that most people don't come into our practice wanting to stay the same. Most people come in here perceiving they have a need, a loss, and want to change. And those changes are not just one recipe and we only make one soup and that's it. We have quite a number of different services on our menu. And Dr. Castine and I work together to plan these cases together and to see them through to completion. For my part, the prosthetic part mine is the fun part. If this was like a home renovation, Chip would be my foundation man. And I'm the guy that comes along and puts all the pretty siding and paint on. So my job is to take the foundation that he's created with 1, 2, 4, 12 implants, whatever it may be, that we decide that we need to complete the plan ahead, and it's to put functional teeth on those. And we want them to be gorgeous and beautiful, because what's the point of having really great function if we can't look good as well, for all the efforts we do. Part of that, a bit large part of that, to be fair, is made possible by the fact that we have what we call an in-house lab, but it's not just the lab and the fixtures and the machines and all the stuff, but it's the people that are there. We have a master level technician that I work hand in hand with daily, and he is usually very involved with us in terms of I'll call it as in you, the patient, looking at what kind of a look do we want to have. Once Chip gives me a foundation, we can build almost any kind of a house on top of that you desire. And that is what makes it fun, and that's why I came out to Bakersfield to do this with him. At this point, many times I kind of open this to having questions, because I usually want to deal with the folks that are in front of us when we do these little lectures, because everybody has some specific questions, but I don't know if that's, Ashley, yes or no, raise your head. Is it possible for somebody to ask a question on this setup?
No, we're not going to do questions, but what we can do is let everyone know that if they're interested or have more questions, we're happy to speak with them over the phone or to schedule them a free consultation. And anyone who comes in after attending this lecture or viewing this video for their free consultation is going to get a treatment discount if they decide to move forward with treatment.
Hey, that sounds fun. So I guess we're not going to do a question and answer here. So whoever is listening to this, come in and see us, and we will do those questions and answers. That for me is kind of one of the fun parts we do, is actually the initial meeting and sitting down and saying, all right, as Chip would say, what's your dream? What is it you would like to have? What haven't you had for a long time, and where can we go? And in 35 years of doing this, we've never not been able to come up with a solution that meets the needs and goals. And also we try to corral it, keep it within a tolerable family budget. So all those things are considered at one time. And I say that's the fun part, is the designing and planning for, I'll call it our new adventures, because every day that's about what it is around here. So I will probably leave it at that and just bait you with that. So come in and chat with me and Dr. Castine, and let's see what we can do for you. It's always fun. Thank you.
Okay.
Hey, Ash.
Thank you for attending or for viewing this video. I will personally be reaching out to the viewees and the attendees of the lecture. And additionally, feel free to contact our office, 661-861-8000, and we will get you scheduled for that free implant consultation at any time. Thank you so much, and everyone have a wonderful Thursday night.